So we're talking about the kidneys and we're looking at the estimated glomerular filtration rate. Let me slow that down so I'm not so tongue tied this time. When we look at this, once again, normal is greater than 90, optimal is greater than 90. And as it states there, this is how well your kidneys are cleaning the blood, but it's an indirect measurement. If you want to get a more robust look at your kidneys, you should also do the urine albumin creatinine ratio. And if you start to see that in the urine, that albumin and creatinine in the urine, there could be some kidney damage, and that should be looked into. But being in the Midwest, your most common causes of kidney damage, high blood sugar. So are you diabetic or pre-diabetic? Do you even know what your blood sugar readings are, and do you know how to take them? High insulin. Insulin is there's another video in our series on insulin and blood sugar, actually. But when you have high insulin, insulin is a very anabolic hormone and it starts to create all kinds of havoc in the system. And that system is known as your body. You do not want to have chronically high insulin levels. This will damage the glomeruli and the nephrons in the kidney, causing damage that will take a long time to repair. High blood pressure. When you have high blood pressure, you're forcing things through the kidneys faster. The volume of fluid that is in your body is greater, so you're making the pump and the filters work harder. NSAIDs, especially daily use of NSAIDs, is extremely hard on the kidneys. And tobacco. Uh, I really don't know of any. Tobacco's kind of like sodas. There really are not any redeeming properties for tobacco or soda. There's nothing inherently healthy about it on either one of them. And so you should just stop if you're using those things. Last but not least, alcohol. Daily use of alcohol has been shown time and time and time again to damage the kidneys. If you want to have a drink at a celebration or two, that's acceptable. But a drink of alcohol should be enjoyed on special occasions. It should not be a nightly thing. The best thing I tell my patients is just because you can doesn't mean you should. And so that kind of wraps up our talk about the kidneys and how the kidneys are affected. And a lot of these things are lifestyle issues. And that's what we at Integrated Health are here to help you do. Identify the lifestyle issues, start to put a plan in to take care of those lifestyle issues so that you don't have to be on dozens and dozens and dozens of drugs. I know of patients who had kidney damage and they were in kidney failure and they did lifestyle changes and have come out of it smelling like a rose. Their kidneys are back up into, they're not 90 yet, but they've gone from that 50, 60 range and they're now in the high 80s. So you can absolutely do something to help your kidneys, and you should, because going on dialysis really isn't fun. I have patients on my chiropractic side that are in here all the time. Oh, I got to go do my dialysis, or tomorrow is my dialysis day, and I'll be in to see you after my dialysis because I got to sit there for hours on end. It's just not a way to live. So we'll see you on the next one. Integrated Health of Indiana is here to help you, and we'll see you next time.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in person and virtual consultations. Thank you.